What's the report you're publishing today?
The report we're publishing today is called Saving STPs, Achieving Meaningful Health and Social Care Reform.
And why have you decided to publish it now?
So the NHS and social health care systems are under enormous pressure, and we hear stories every day in the news about how patients are getting caught on hospital trolleys while waiting for beds to become available. Now, the NHS and social care system should support people to remain healthy at home for as long as possible, and when they do get unwell, they should be treated in the right place by the most appropriate people. STPs are trying to deliver this. They're trying to integrate health and social care, so the systems are much more streamlined and easy for patients to navigate, and this is the right thing to be doing. But having spoken to a number of people about it, we found that STPs weren't going to deliver on this, and that's why we've done the paper.
And what were the problems or the barriers then that the people you spoke to identified?
The first problem we identified is that there have been mixed messages from national bodies. So NHS England have been focusing on transformation as a whole, whereas NHS Improvement have been focusing on balancing the books. And there's also been confusion among STP participants as the extent to which they're legally allowed to collaborate under existing competition legislation.
We found quite a fragmented system, so at the moment the budgets for health and social care are completely different, so primary care, secondary care, public health and social care are funded differently, and this makes it difficult for organisations to act together rather than in their own self-interest.
And to address this issue, everyone needs to be on board with the plans, but we found that engagement's been limited, that there's been insufficient involvement of local authorities. In the first draft of the plans, many of them did not even mention mental health. In a survey last autumn by the British Medical Association of 614 GPs and consultants in London, 66% of GPs and 53% of consultants had not even heard of the plans. In many areas the public have been opposing them, and there's a concern that politicians will withdraw their support.
Yeah, so in the past, for example, and now in fact, when trying to move care from hospitals into the community, this has involved closing of accident and emergency departments, and that's always come up against fierce opposition from local councillors, local public and local MPs.
Okay, so quite a few issues. We've got issues around kind of conflicting messaging and guidance, obviously fragmented system, both in terms of structures and finances, and then a question around the buy-in. So some pretty meaty questions that I guess the healthcare system has been facing for some time now. You mentioned at the start, though, that you still believe STPs are a good thing. So how can we make them work?
Yeah, so we do believe that STPs are the right approach, and the first thing to be doing is for NHS England and NHS Improvement to clarify some of the guidelines, particularly surrounding competition and integration.
Which I guess would be a kind of quick win then, just to do that immediately.
And to address the issue of fragmentation and enable everybody to be working together, people within the STP need to be working from one budget towards shared outcomes, and these can be determined locally. This is what we're seeing with the Greater Manchester model.
STPs are also struggling with accountability and governance. We believe that one way to address this and to provide the STP with more legitimacy would be to introduce an accountable elected individual to sit at the top of the STP and be in charge of the budget, and this could be a healthcare commissioner or a metro mayor.
Okay, so lots of stuff there. Government obviously prioritising STPs at the moment. What is the headline message that you want them to take away from this report?
So we believe that the vision for STPs of an integrated health and social care system is the right one, but in their current form they're not going to deliver. The government needs to act now in order to align incentives and give real power to local areas.
Great, thank you very much.